So menopausal symptoms is a hush-hush thing. Asian women don't talk very much about it, but most women will have some form of menopausal vasomotor symptoms in the perimenopause. What are vasomotor symptoms? Vasomotor symptoms are recurrent transient episodes of flushing accompanied by a sensation of warmth to intense heat on the upper body and face. As many as 75% of perimenopausal women will have some form of vasomotor symptoms. Thankfully, Asian women are have less so in terms of percentage. They are less prone to having vasomotor symptoms. And these symptoms may be triggered by small increases in the core body temperature acting within a reduced thermoneutral zone. This basically means something goes wrong in the thermostat in our body during the menopausal years, and that results in this kind of first sudden heat and then sometimes chills and shivering. And during this time, the heart rate can increase, the skin blood flow can increase, and that can result in sweating. So redness, sweating, and then chills and shivering. So these are things that happen, and they can be quite disruptive to a woman's lifestyle. They can, for example, one of my close friends, she sits on the board of a big bank in Singapore, and she says that, oh, during this time, I am giving an important presentation and all these important people are there. And I suddenly have a flush and I suddenly break into a sweat and everybody's looking at me and it is so embarrassing. So yes, it can affect a woman's life. It's not dangerous. It's a transient problem. In most cases, the body will get used to the menopausal change in hormones, and when the hormones get stabilized, it will all become okay, and she won't have this vasomotor symptom as much. But she can never predict when this comes on, and it can affect a woman's quality of life in a big way. We'll talk about how to deal with this, both using lifestyle measures as well as hormone replacement therapy. And then also in some women who do not want to or cannot take hormonal medications, those women should not fret, because there are non-hormonal medications that can be used. A lot of mood disorders, which are feelings of upset, loss of control, irritability, fatigue, blue moods in the midlife. And all these are caused by fluctuating hormonal levels. Oftentimes, the family members, the kids, the teenager kids or grown-up kids or the husband will bring the woman in because they feel that this lady who was such a kind, gentle soul has become a monster. But all these could be because of the hormonal changes that she's going through. Some women, it becomes so bad that they may be having depressive symptoms. And these symptoms are more common in women who have a history of premenstrual syndrome, who have undergone significant stress, who have sexual dysfunction, who are inactive. If they don't exercise at all, they tend to have less of the feel-good hormones in their body, and that can cause problems. Again, women who have history of hot flushes or a prior history of clinical depression are more prone to depressive problems during the perimenopausal years. So what works? Relaxation and stress reduction techniques, pick up a new hobby or start exercising with another group of like-minded women. Some counseling, psychotherapy can help, but if all these do not work, then some women, a small proportion, can be treated with antidepressants. Now, urinary incontinence, I won't go in a lot of detail for this because next week you will hear from Dr. Ng, who is a urogynecologist. She will talk to you all about this. So urinary incontinence, or the involuntary leakage of urine, is common in midlife, and about 20% of all women will have this in some form or the other. What causes it? The reduced levels of estrogen starting around the menopause can thin the lining of the urethra, the little pipe that through which we pass urine out of the bladder. The surrounding pelvic muscles may also weaken with aging. This is a process known as pelvic relaxation. So everything becomes very loose, just like the skin of the face becomes loose, all the muscles, all in the pelvis all become loose, and that can result in an inability to hold urine when it should. Also, some women may be complaining of overactive bladder, and I will leave this to be covered in the next talk next week. So the main risk factors for developing urinary incontinence are vaginal childbirth and increasing age. And yeah, so I hope we will all learn a lot more about this condition from Dr.
Taking calcium does not seem to help reduce osteoporosis if one is menopausal.
So think of it like this. Bones, like as we grow older, think of your bone as an old building, and old building will have wear and tear, it will keep breaking down. Now to keep it standing properly, you need to repair it. That repair thing is the calcium. But to transport this calcium into the bone is the estrogen that is needed. Otherwise, there's a lot of calcium floating around the building, but it cannot be put back onto the building. So to make the building, which is crumbling, stand back again, you need the calcium. But the estrogen, the hormones, are what put this calcium into the bone. So after menopause, because there is no more estrogen, this calcium repair does not happen. And that's when the bones, they start to crumble again. Okay, so it's not just taking calcium and vitamin D. Yes, in the initial years, when you still have some estrogen, that estrogen will help repair your bones that are becoming more porous. But as you age, that estrogen is not there, and then however much calcium you have, you cannot deposit it back in the bone. So that is when, if it is really a problem, and if your bone density shows that you are at high risk, or you have a lot of risk factors that make your bone at high risk of having a fracture, that's when we need to do something. Either we try and give you medications that will prevent this bone from crumbling, or we give you medication that will help the calcium repair happen, calcium deposition in the bone from happening.
Should we still take calcium if no estrogen to help with the absorption?
So all of us, it's not as if estrogen is zero after menopause. The body fat that we have in our body, especially the abdominal fat, which is not just on our waist and hip, but also within the abdomen, that secretes a weak estrogen, which helps in keeping our bones healthy. Otherwise, 100% of us will have fractures or osteoporosis. Not all women will have it. So those women who are very skinny, who don't take any dairy products at all, don't take any calcium, so those are the ones who will have a higher chance of developing osteoporosis. So calcium is important. Remember, calcium is required to repair this building. Estrogen is what is transporting, which is using this calcium and putting it in the bone. Okay, this estrogen in the younger years is very efficient because it can very quickly repair any bone damage that has happened. But in the menopausal years, this estrogen is a weak estrogen. So it will slowly put the calcium in. But if there's no calcium at all, then it won't be able to do anything. So calcium supplements still important in the old age.